Hello everyone, I'm Anas Al-Ubaidi, and the topic or the title for this session is Final Assessment, Hematology and Oncology Scribe Certification Exam within Chapter 32, which is about review of Hematology and Oncology Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The final assessment for hematology The final assessment for Hematology and Oncology Scribe Certification exam represents a pivotal challenge for medical scribes specializing in these demanding medical fields. Hematology and oncology are complex and specialized areas for medicine that deal with the critical conditions such as anemia, bleeding disorders, hematological malignancies, solid tumors, and metastatic cancers. The care plans and interventions in these areas are intricate, making accurate and detailed documentation an essential component of high quality patient care. Hematology focuses on disorders of blood and bone marrow, including both benign and malignant conditions such as sickle cell disease, clotting disorders, leukemias, and lymphomas. Scribes are responsible for cataloging laboratory or lab results, diagnostic images, transformation details, and specialist consultations. A typical example would involve capturing details of a bone marrow biopsy, noting samples reveal 65% hypercellularity with blasts constituting 30% of marrow cells, consistent with acute myeloid leukemia (AML). Oncology covers the diagnosis and management of cancers, including solid tumors affecting the breast, lungs, colon, and prostate, as well as blood cancers such as multiple myeloma. Oncology scribes must thoroughly document cancer staging, for example, T3N1M0 or M0 tumor 5 centimeter involving regional nodes with metastasis. Treatment plans example surgical interventions, chemotherapy regimens, and radiation courses, and patient responses to care. The unique responsibilities of scribes in these specialties extend beyond transcription. They must identify and document key laboratory or lab findings, monitor treatment milestones, and flag critical changes in patient status for the healthcare team. For instance, in oncology, tracking molecular markers such as HER2, HER2 status, or documenting chemotherapy side effects like febrile neutropenia ensures effective clinical decision making and compliance with guidelines from organizations like the NCCN National Comprehensive Cancer Network. This exam assesses the depth of knowledge, skills, and application that scribes need to manage the unique challenges of these specialties. Key points. Hematology documentation essentials. Key hematological disorders. Effective documentation in hematology involves understanding common and complex conditions, such as anemia types include microcytic anemia, for example, iron deficiency, and macrocytic anemia, for example, vitamin B12 deficiency. Document lab findings such as hemoglobin HB 9.2 G per DL, MCV 78 FL consistent with microcytic anemia. Leukemia's detail findings such as peripheral smear shows 20% blasts, bone marrow biopsy confirms acute myeloid leukemia. Bleeding disorders record clotting profiles and genetic testing, for example, factor VIII deficiency in hemophilia A. Thrombocytopenia, not causes such as drug-induced thrombocytopenia, ITP, characterized by platelets 20,000 per UL with petechia. And here is a diagram visualizing key hematological disorders. Lab or laboratory and diagnostic tests. Prominent lab reports in hematology include CBC, complete blood count with differentials, coagulation panel PT over I, or PT/INR, APTT, bone marrow biopsy reports, and flow cytometry. Therapies and interventions. Hematology treatments often involve significant interventions like transfusions. Record the type used, PRBC, platelets, or plasma. Example, 1 unit of PRBC transfused post HIP-HB or hemoglobin 10.3 G per DL. Erythropoietin stimulating agents, ESAs, include details for anemia management in chronic kidney disease or chemotherapy. Plasma exchange for severe autoimmune conditions like thrombotic thrombocytopenic purpura (TTP). And here is a diagram on hematology lab reports and treatments. Common red flags in hematology. Red flags must be promptly documented for immediate action. Severe bleeding, neutropenic fever, hemolysis. Oncology documentation essentials. Uh, we'll start with key cancer types and staging. Detailing cancer stages and key features is fundamental. TNM classification. T for tumor, N for lymph nodes, and M for metastasizing for metastasis. Now, report tumor size, lymphatic support, and metastasis. For example, T3N0M1, non-small cell lung cancer with solitary brain metastasis. Histopathology reports include findings like triple negative breast cancer, Ki67 index 70% indicates high proliferation. Biomarker testing, HER2, EGFR, and ALK are critical for targeted therapies. And here is a diagram showing the oncology documentation essentials. Treatment modalities. Thorough documentation ensures treatment adherence and captures milestones. We have chemotherapy syringes and cycles, radiation therapy, surgical reports. Symptoms and patient-reported concerns record subjective data to track therapy tolerability or disease progression. Worsening fatigue, appetite loss since or loss of appetite since last chemotherapy, grade 2 reported nausea identified. Monitor cachexia symptoms with weight changes noted. Monitoring progress and complications, effective treatment response documentation includes radiologic findings. Examples include post-treatment PET-CT demonstrates metabolic resolution of tumor. Lab monitoring, example, tumor markers, CEA, CA 125 decreasing steadily post-treatment. Document complications such as febrile neutropenia or tumor lysis syndrome, which require immediate intervention. Critical emergencies and oncology emergency situations often arise in cancer care. Tumor lysis syndrome, acute renal failure with hyperphosphatemia initiated rasborikase. Spinal cord compression. Patient presenting with lower extremity weakness and consistence, MRI confirms cord impingement. Summary tables, table on common symptoms and their documentation, table on diagnostic tests and their clinical utility, table on common hematological and oncological conditions, table on common treatments in hematology and oncology, table on red flags and critical documentation in oncology and hematology, and then next we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following is the most critical detail to document during blood transfusion? Is it A, the patient's meal before the transfusion, B, type of blood product transfused, volume, and pre-post transfusion vitals, C, the room temperature during administration, or D, the patient's unrelated medication list? Definitely it's B, as accurate recording of the type of product, example, PRBC or platelets, volume transfusion, vital signs before and after the transfusion is essential. Question 2. What is the significance of documenting CD20 marker status in hematology cases? A, it identifies the likelihood of tumor lysis syndrome. B, it confirms anemia caused by iron deficiency. C, it helps classify lymphomas and guide targeted therapy. Or D, it determines the patient's response to radiation therapy. Definitely it's C. The answer is C here, as CD20 is a marker used in diagnosing and treating B-cell lymphomas. Its presence is critical for therapies like rituximab, which specifically targets CD20 positive cells. Question 3. Which diagnostic detail is most critical when documenting a suspected case of febrile neutropenia? A, anemia severity, B, neutrophil count and body temperature, C, tumor size and imaging results, or D, platelets above 100,000, 100 Q per UL. And the answer is B, neutrophil count and body temperature. The body temperature and neutrophil count, whether neutrophilia or neutropenia. Now, The explanation here, as febrile neutropenia is defined by a fever, example, more than 100.4 Fahrenheit, degree Fahrenheit, and a low ANC less than 500 per UL, requiring immediate intervention to prevent sepsis. Question 4. Why is it important to document tumor staging using the TNM framework, tumor nodes and metastasis? A, to evaluate the patient's response to antibiotics. B, to determine cancer progression and guide treatment planning. C, to monitor electrolyte imbalances during chemotherapy. Or D, to detect anemia severity in cancer patients. Definitely the answer is B, as TNM staging provides a standardized way to describe cancer's progression, aiding in choosing appropriate or proper treatments and predicting prognosis. Question 5. Which red flag symptom during cancer care demands urgent documentation and intervention? Is it a gradual weight gain over 6 months? B. Jaundice with elevated bilirubin and LDH linked to hemolysis? C. Fatigue relieved by rest? Or D. Mild nausea after chemotherapy? It is B. The answer is B, as jaundice with high LDH and bilirubin suggests hemolytic anemia or liver involvement, which may indicate severe disease or treatment complications, as this requires prompt medical attention, unlike mild or less acute symptoms in the other options. And here we come to the end of this lecture. Thank you very much, and goodbye.